Welcome to Peak Health with Dr. Gupta. This show is for those who want to optimize their health, maximize their genetic potential, and have some fun along the way. In today's episode, we're going to discuss something we all do, or should at least do for a third of our lives: sleep. Sleep is so important to our basic health. We all have experienced firsthand what happens with the lack of sleep: fatigue, brain fog, irritability, need for snacking, and low energy. On the other hand, when we get good sleep, we feel amazing. Well, how do we continue to get deep, restful, and restorative sleep every day? To answer that question, we have Dr. Andrew Wong. Andy, as I like to call him, is the co-founder and director of Capital Integrative Health. He graduated from Tufts Medical School and completed his internal medicine residency at Georgetown University Hospital, and is board certified in internal medicine and integrative and holistic medicine. He also has advanced training in acupuncture, functional, and integrative medicine. Welcome, Andy.
Hey, Ravi. Thanks so much for having me on your podcast. Really appreciate it.
Absolutely. Happy to have you here. And we'll just start off with a very simple question. Why is sleep so important, and what happens when we're sleeping?
Well, first of all, I have to say on your podcast that just kind of shout out to you, Ravi. You're a role model for a lot of us other doctors, and you were actually one of my attending physicians at Fairfax when we were going through Georgetown. So I just wanted to mention that. And I wanted to segue into sleep because let's face it, as residents or as attendings, and in the medical field, we don't get a lot of sleep,
Yes.
Right. So in fact, I think it's kind of this idea of and whether you're listening as someone that's currently working or retired or whatever you're doing, you're maybe at home with your kids or have errands to do. I think it's a society, Ravi. We don't necessarily sleep is the last thing that is on our list of to do, right? Because it's considered a passive activity. And one of the things we love to talk about today in the podcast is how sleep is far from a passive activity. In fact, it's probably the most active thing you can do, and it's the best thing you can do to up-level your health.
Excellent. Well, yes, and thanks for that. Those kind words there. I do remember you as a resident, and I tried to allow you enough sleep, but the patients did not. So.
Oh, you definitely allowed, but the way the system is, right, and the beeps of the 3 a.m. Fleet's enemas and things like that, that's
right.
But yeah, so I think the first thing we have to think about is that sleep deprivation is a public health epidemic. I mean, it really is a huge problem in its scope. And that starts from the fact that we don't value sleep the way we value nutrition, the way we value exercise. We all know that we want those six-pack abs. We all know we're trying to lose weight to look better at the beach or just to have better health, prevent cardiovascular disease, prevent dementia. But we don't understand that sleep also is, I'm going to argue today that it's probably more important than any of those lifestyle factors, because if we don't sleep, we won't really want to eat healthy. And we'll get into some biochem if you like. We are also not going to be mindful with our people that we're in relationships with. We won't be present the way we would if we got more sleep with our kids and partners. And then honestly, we won't have the energy to exercise. We won't have that performance jolt that we need to do strength training or cardio, whatever we're trying to do on the exercise front. So to me, it starts with sleep in terms of the lifestyle factors. But I will also just say that, we kind of wonder what the scope of this issue is. And we know that about over a third, about 35% of adults in America sleep less than 7 hours a night, which is the recommended NSF, National Sleep Foundation, sort of for adults, 7 to 9 or 7 to 8 as people get older, hours a night. So only less than 2/3 of people are getting that. And I would suspect it's even worse during the pandemic. But certainly that impacts the health system as a whole, individual people's health, but also our economy, the way that, people are not working productively. They're not, whether it's home or in a business or something, if we don't have that energy, we're not going to be able to functionally do the things that we want to do and be the people that want to be in our lives.
Yes. And I think you made some great points. And one of them that I want to stress is people feel that sleep is time that you can potentially tap into to take care of other types of tasks, or, maybe watch a movie or do some things that you've been putting off for some time. Hey, I'll get a couple hours less sleep at night and then do these things. Well, the bottom line is, as you mentioned, it shouldn't be that way. Sleep is so important for your general health and well-being. you should really take advantage of that full amount of time.
So there's this quote about sitting is the new smoking, right? You've heard of sitting is the new smoking.
Yes.
I would argue that not sleeping is the new smoking. Pretty much every patient, and we have a pretty busy clinic here in Bethesda, Capital Integrative Health. But you've been here, is that, when you ask people, hey, how are you sleeping? I mean, it's a rare bird that's like, hey, I sleep great.
Yes.
Most people get woken up by their bed partner or kids or by their own thoughts, their own racing thoughts, and how there's actually this concept that, because I like to make up acronyms, there's something called TMOYP. It's not found in the ICD-10-DX, but it's TMOYP is too much on your plate syndrome. So too much on your plate, TMOYP.
Yeah.
So think about, how much stuff you have to do in your life, Ravi. You have a family, you have, successful business and all these other things you're doing. So if we're all juggling these things on our plates and then it's either too much or we think it's too much, then the hormones that are going to go up are things like cortisol, which is a stress hormone, or adrenaline, or things like this. That's why we try to take things like sleeping pills. But the problem with sleeping pills is that's not the answer, because people get addicted to sleeping pills, and they also interrupt deep sleep and things like that. So one of the things that we have to think about in terms of sleep is, do I have too much on my plate? And I would say for me personally, I've had trouble sleeping for a number of years. It might have started during residency, but no, not because of you, but just from, just the nature of the hospital. And we think about sort of this idea of, how much do we have on our plate, and like, how can we offload that at least mentally so that we can go to sleep better? One of the things that I found, because it's a lot of these things in sort of integrative or functional medicine, as it becomes a personal passion, it becomes a calling. So it's not just like, I'm going to read some books, I'm going to treat patients, right? But it's also like, well, how's this affecting my life and my health and my family's health? And how can I be of best service to others, as I learn these things, right? Because at the end of the day, a lot of times, what I've found, at least with talking with patients, is that unless I've either experienced it myself or really heavily researched it and talked to experts about it, it doesn't carry the same weight as if I it carries more weight, I should say, if I did experience those things. Right. For sleep, so offloading things is going to be really helpful, whether that's, having assistance or, just asking for help from people. People are willing to help. And that's another thing about our society, I would say, is that, for the listeners out there, you're not alone if you're having trouble sleeping. Pretty much that's like everyone is having some trouble sleeping.
What happens when we're sleeping? Like, why is sleeping so important? What's going on in our minds?
Yeah. So I think we should rename sleep rejuvenation. What's happening is the body and the brain are rejuvenating. So let's start with the brain. So during sleep, there's clearance of these plaques in the brain called beta amyloid plaques. Now, some people have heard of this because beta amyloid plaques are one of the things that can trigger Alzheimer's disease. It's not necessarily thought that they're always the actual root cause of it, but there are some other things we can talk about beta amyloid plaques. But let's say that there's an association, at least, between the number of beta amyloid plaques in the brain and the risk of Alzheimer's dementia. So during sleep, especially during the first phase of sleep, which is mostly where the deep sleep happens, during deep sleep, there's actually a lymphatic system in the brain called the glymphatic system, G for glial lymphatic system. So the glial cells have this lymphatic system. And basically what happens is during deep sleep, there's clearance of these plaques of beta amyloid, clusters of these, protein aggregates from the brain. And other neurotoxins as well. So that's sort of when the trash dump kind of happens, or the recycling dump, I guess, happens for those brain neurotoxins during deep sleep. So the brain is rejuvenating by detoxifying. And if someone doesn't sleep as much, say less than 6 hours, there's going to be less clearance of that beta amyloid plaque. The way I explain it to patients is that, let's say, Ravi, your recycling truck came to your house once a week. Okay. And you knew it was going to come once a week, and you put out the recycling so that you could clear your house and it could be all nice, spick and span. Your family's happy and everyone. So if the recycling truck only came every 2 weeks, it's still going to start to build up and cause some issues in your house. So that this is what's happening in the brain as people are getting long-term shorter sleep, is that these neurotoxins like beta amyloid plaques are building up in the brain and then likely triggering more brain inflammation and an increased risk of Alzheimer's down the line. So that's one thing that's happening, is daily detox. Another thing that's happening is that in sleep, you're getting a consolidation of memories, and especially the memories from the previous day before. So let's say you had some meetings and you're playing with your kids, and you did some fun activities or whatever, and whatever is happening in that day, which you just had before you hit the pillow, it's going to contribute to potentially some insights and some inferences and things that you're going to gain. What did you glean from that day? What did you learn from that day? And this is something that's happening during sleep. So it kind of consolidates that. So if you remember the times before Google, right, we had these personal computers, and then there was like a little hard drive thing that you have to back up your files to. I mean, I guess now everything can be backed up on Google, right? But if you think about it, it's kind of like all those memories from that day are getting backed up long term in your hard drive during sleep. But without sleep, it doesn't really happen. So those are kind of some of the big things that happen during sleep. The other thing that happens during REM sleep, which is usually during the second half of the night, is emotional health. So let's say you had some difficult experiences that day, maybe, or whoever's listening, maybe you had some emotionally charged, whether it's joyous or sad or difficult or whatever. But sleep helps you make sense of those events emotionally and process them, right? It's almost like your own natural therapist, in a way that happens during sleep. So we know that sleep deprivation is associated with an increased risk of mental health issues, including anxiety and depression and bipolar and ADHD. And so sleep disruption may actually be a cause of mental health issues. It may actually cause those issues via disruption of the methylation pathways, which means, sort of this way to influence neurotransmitter production. I think that in terms of physically, let's go into the immune system. So we know that, we're still in the COVID era, we're in 2022. Again, sleep is rejuvenation of the brain, but also rejuvenation of the body. It is really one of the most active processes that you have, just because we're kind of, we're not conscious during sleep, but there's a lot of things happening. In fact, the immune system is most active at night during sleep. So we know from a lot of studies that restorative sleep helps regenerate the thymus, which is one of the most important immune organs. We also know that healthy sleep will help promote what's called T helper cell 1 response. And that is a response that supports an antiviral immune response. In other words, the better our Th1 cell activity and number, the better our outcomes will be likely if we get viruses, whether it's COVID or some other virus. So it actually helps our immune system. Another interesting thing about sleep, because it's kind of flu season now, or going to be soon, is that we know that if people get a good amount of sleep, which is again more than 6 hours before a flu vaccine, their antibody levels in response to that flu vaccine are going to be higher if they get more sleep versus if they didn't have sleep. So one of the things when people are getting, COVID vaccine or flu vaccine, and they're like, well, how can I be healthy, and how can I take this vaccine, effectively? And I tell people, you need to get a lot of sleep that night. Don't drink alcohol, go to bed early, get a good amount of sleep so that your antibody production or response to that vaccine is going to be higher.
Yeah. That's really interesting, because, our mothers and their mothers have always told us in the past, hey, get a good night's rest. It's going to help you. It's going to help you. Your sickness will go away. And it was sort of like an old wives' tale for a long time, but now the research is coming out where this is indeed true. Getting a good night's rest will actually boost your immune system. It'll help fight off various types of infections.
Yes. I mean, I think we all remember when we were in college, or at least I remember when I was sleep deprived, right? Studying for an exam, lo and behold, that's when I got a cold. Right. 3 hours of sleep, eating badly, eating a bunch of sugar, right? Then, of course, the immune system's stressed out and needing to kind of reduce inflammation from that sugar and from that lack of sleep. So it's kind of like the soldiers of the immune system are diverted to a different area, so then it can't really protect your body from infections. The other thing is that, when you think about sort of wanting a good gut, well, there's gut health, but also when I mean gut, I mean just like belly, like trying to reduce belly fat, right? We all want to reduce belly fat. We all want to prevent heart disease. One of the things that happens during sleep is that sleep definitely changes the balance of different hormones. So chronic sleep deprivation basically leads to a few things. It leads to more fat storage. So basically there's elevated cortisol, elevated insulin, which leads to visceral fat deposition in the belly, more belly fat. But the other thing that happens is that ghrelin, which is a hunger hormone, goes up. And leptin, which is a satiety hormone, meaning you're going to feel more satisfied when you eat, that leptin hormone goes down, which basically means that when you don't get enough sleep, you're going to store more belly fat and also you're more hungry, especially for carbohydrates. So there's a lot of reasons, I think, why nutrition and like eating healthy, so if someone is having trouble sleeping, I'm not going to tell them to eat like this perfect diet because they won't be able to do it. They have to get sleep first.
Right.
Because of those hormonal shifts there. The other thing I should mention is that, we all talk about detoxification and how it's good to help with liver detoxification and help prevent, illnesses through good detoxification of toxins in the body. The detox system is another area where it's more active at night. So the liver is more active at night. They've done ultrasounds on people's livers, at nighttime, and the actual size of the liver is bigger at night, like the mRNA and basically the size of the liver. So what's happening is that again, just like in the brain, I guess the body's just saying, okay, you're sleeping, and we're going to start doing these maintenance and rejuvenation processes now that we didn't have time to do in the day. Because you were stuffing your liver with alcohol, right? Or you're stuffing your liver with a bunch of food and medications and supplements and things that needs to detox. So same with the brain. I think same with the brain. Okay, you were stuffing your brain with, great experiences, difficult experiences, packed with emotion, analysis of, things during the day. So your brain was working during the day and processing. So now we need to rejuvenate. We need to detox the brain as well. So you see how the way I like to look at it, and I think, Ravi, you'd appreciate this, as I'm assuming you're a car aficionado. I don't know, but I use a lot of car analogies, so just bear with me. So let's say you had a car and you were driving it all up and down, 495 or Lee Highway at least or something, right? So what if you just drove that car 24/7 and you didn't give it a break? You didn't park it in your garage. The engine would go out. There'd be some rust on the car and stuff. So we have to basically, as people, as a society, learn to rest. And I don't just mean physically, I mean mentally, emotionally, spiritually. We need to learn to park that car in the garage. We need to learn to park our bodies in bed so that we can rejuvenate. And, one of the things that we should mention, I think, early on here in this podcast, or at least in terms of some of the lifestyle things, is we have to turn the lights off. That sounds kind of dumb. It sounds like a sleep for idiots, but I think we're all idiots, right? In that way, kind of like, we all kind of turn the lights on at night sometimes. I think that even the most, vociferous anti-cell phone people, it's hard because cell phones are addictive and TV is addictive. And now we have Netflix, right? So what happens is...
Let me interject here. Andy, so this was all amazing information. And you just basically, in a nutshell, describe to us the importance of sleep and how it helps you with detoxification, with immune support, with just general rest, well-being, to assimilate, organize our thought processes. So that was wonderful. I appreciate that. Now you're starting to get into lifestyle and sleep hygiene type issues. So maybe let's jump to that. What are some ways? Because as you're describing the benefits of sleep, I'm sure a lot of listeners are thinking, okay, that sounds awesome, but I just cannot sleep. I mean, I lie down, I do my best, and I get like 3-4 hours a night, and that's all I get. I'm tossing and turning. So what can one do to better their sleep and not pop a pill? Now we'll talk about popping pills in just a little bit, but what are some techniques, sleep hygiene techniques that people can do that are natural, that'll help them get better sleep?
Well, there's two major lifestyle factors, I would say, that have the strongest effect on the day-night cycle, that circadian rhythm. And those two are in order of importance, I think. Number one, light, and number two, food. So let's talk about light first. So if we're trying to sleep, historically we had moonlight and otherwise it was kind of dark, mostly. So we kind of probably, had huts or houses or maybe slept in a cave or something, but it was dark. There weren't any cell phones, there weren't any like TVs or something. So we know that what happens at night is that melatonin, which is a hormone that helps us to go to bed, goes up. And then cortisol, which is a stress hormone that helps us to be alert and to have energy and things like that, goes down at night. So melatonin goes up, cortisol goes down. So the first thing we want to do in terms of, lifestyle is really sort of try to time our sleep to a time when we're going to be decreasing our light at night, or basically trying to make it dark. So whether you're listening to this and you're like, well, you know what, I'm a nurse on a night shift, or I'm a doctor on a night shift, or I'm a firefighter, right? We have patients like that. Well, the way you try to mimic that is whenever you're going to sleep, just do pitch black. If it's daytime for you, then do that. But you have to have your body kind of see in the external environment, ideally, that it's nighttime. So turn off all the lights, blackout curtains, eye pillows, anything like that, to basically simulate that dark environment, because that does have the strongest effect on the circadian rhythm, is going kind of as dark as possible.
What about blue light blocking glasses?
Yeah. I use those pretty much every day. You can get them on Amazon. They're pretty cheap. There's other more expensive sites you can do as well. But you need to block blue light, which is mostly found in things like computers and tablets and screens. It's a pretty high percentage of blue light in those. So you want to try to avoid those at night. And if you can't avoid those, and also things like light bulbs, they have blue light in them. So if you can't avoid those because maybe you want to read a little bit before bedtime, wear those blue blocking glasses before bed. I would say ideally 1 or 2 hours before bed. Just start wearing them to get into that habit of what it'll do is it'll just filter out the blue light so you won't see it. And then you'll basically be seeing hopefully like an amber type of tone, which is kind of mimicking more firelight or dusk type of light.
Okay. So Andy, basically what you're mentioning is the blue light suppresses your melatonin. And you want to do that when you wake up. Like when you wake up, you go outside, you look at the sun. This is very important because it not only kind of resets your circadian rhythm, but it makes you feel good. And then you're actually resetting melatonin so that you suppress it. When you're approaching bedtime, you wear the blue blocker glasses. Your room is pitch black, and that allows the melatonin to maximize, and then you get that restful sleep. Ideally, the cortisol will drop, melatonin will rise. That's in essence what you're doing with light. Is that?
Yes, exactly, Ravi. In fact, like you just said, it's actually, I think, more important to reset that circadian rhythm by getting that light exposure 12 hours before you want to go to bed. So that's a key right there, to kind of stimulate that system to start kind of understanding what is day and what is night. So a lot of us, I think, have lost that, or I guess that circadian rhythm is getting frayed by lifestyle. So the more we can kind of get sharper on that in terms of what's day, what's night, when you're going to sleep, when you're not going to sleep, I think that's going to be the biggest thing there. In terms of timing, also, I just wanted to mention, because I think a lot of people ask, what time, is 8 hours from 1 a.m. to 9 a.m. the same as 8 hours from 10 to 6? It's not. It's not, because the detox system and immune system are more active in those early hours of evening time right before midnight. So I like to say, trying to go to bed before midnight. If you know the story Cinderella, right? When the clock strikes, midnight, the foot people turn into pumpkins and stuff like that, right? So you really want to try to go to bed before midnight if possible. And ideally something like 10 or 11 would be sort of a maximum. And then that's going to get that detox and immune boost there from sleep. It's going to maximize your sleep. I've personally found that to be the case. If I go to bed before midnight and I get the same amount of hours that I did if I went to bed after midnight, I find myself to be more rested.
Yeah, and there are many wearables that you can use to track your sleep. I personally like the Aura Ring, and So, and did you have that?
I do. I have the Aura. Luckily,
Yeah.
it got upgraded to Aura 3. So I love that because it actually changes my behavior. If I get up in the middle of the night, then I'll make sure to go back to sleep. And my sleep hygiene is actually better. So I don't know that, I think the Aura is also good because it tells you about deep sleep and REM sleep and O2 sat now and all this stuff. But to me, what it really does is it's kind of like an accountability partner on my finger, kind of like, okay, hey, dude, you should go to sleep now.
Yeah. And I love that for that reason. I used to wear it, and when I would get a low score, because the Aura Ring grades you as far as your restfulness, how well you slept that night. I'd get a low score, then I'd be like, oh man, I would get stressed out by it. I'm like, oh, I didn't get good sleep. And then the next night I wouldn't sleep again. And I was like, oh, I don't know if I want to wear this. But when I got over that, and I actually was like, wait a minute, I'm not going to wear this for that to get the highest score. This is not a competition. This is a way for me to try to understand what helps me sleep. And, I'm curious rather than, judging the result. That helped me tremendously. And actually, I wear it every night now. And I see now, exactly as you said, when I sleep starting at 10 o'clock, I go to sleep at 10, I will get much better sleep, much more restful, much more deep sleep than I will if I go to bed at 11 even, or 11:30 or even midnight.
I think we're brothers from another mother because I had the same mindset block and I had to overcome it. I was like I wanted it to be perfect or at least really good. And I didn't like the fact that the score was low. So I stopped wearing it. But then I recently did the same thing. I started to wear it every day because I was just like, I just want the data, no judgment.
Yes.
Just wear it. And it helps, but I think the big thing for the listeners is consistency, whether it's you're doing the sleep hygiene, you're trying to go to bed at the same time every night, ideally, or you're doing an Aura Ring and you're getting some data that way. Just keep on doing it. Just keep being persistent with it and the results will come.
Yes, absolutely. And I'll just stack another few points there. Avoid caffeine. Ideally, if you want to drink something before noon, if you have to push it maybe before 2, but ideally before noon, and stop drinking after that because that's going to affect sleep. No eating or drinking 3 hours prior to going to sleep because your body's going to take time to process that food. You don't want that to happen while you're trying to rejuvenate and restore. And make sure your bed is for sleep only and you aren't working in bed or doing other activities in bed. That's not conducive to sleep.
Yeah, sleep and sex. I think sleep and sex, but and also besides caffeine is as alcohol. Let's talk about alcohol for a sec. So, alcohol. I know when I was in school, Ravi, we were taught that one drink a night is healthy. I mean, there could be some health benefits from obviously red wine and things like that, some of the antioxidants in there, but alcohol does disrupt sleep, especially it especially increases. So it helps with what's called sleep latency. So we fall asleep earlier. So that data is there. But in terms of sleep quality, it affects sleep quality, especially in the deep stages of sleep. So people wake up sooner, they wake up more, things like that. Don't sleep as well. I don't know if you've found that, but I've certainly found if I drink alcohol, I won't sleep as well. I'll like conk out really quickly. Especially I remember those Georgetown days. I mean, gosh, those were that was the especially
you needed to survive. Yes.
Yeah, exactly. So if you think about it, alcohol is one of those things that will disrupt sleep. And if someone's having a sleeping problem, the first thing I'm going to ask them is, are you drinking alcohol? If so, try to stop it. They might not like me that well after I say that, but that's really the honest truth is we have to think about some of these big, basic lifestyle things that people are doing. Are they drinking too much caffeine or alcohol? Are they on their cell phones at night? Some of these big things that to me, those aren't really insomnia. Those are sleep hygiene issues.
Yes. Now, how many hours before sleeping would you recommend a glass of wine?
Never, but not just, yeah, I think, probably 4 hours would be ideal because then you're at least starting to metabolize it a little bit. There might be some things to mitigate the effects of alcohol, sort of like antioxidants and things like that. But I think in general, if you can experiment, who's listening out there, if you're listening and you're saying, well, I do fine, I do fine with alcohol. You might want to experiment without it to see how much better you can sleep, right? Because we know from the performance side of things, right? athletic side of things or wellness side of things, that we don't know how good we can feel until we experience that. So someone out there might be listening and saying, okay, I sleep fine, but maybe you don't know how much better you can sleep if you didn't have the alcohol, if you didn't have that glass of wine. And there's times you can have it too. So you can kind of just write in a little journal, right, to see, or use a wearable like an aura to see what that does. I don't know if Ravi, you've used the aura to
Yes.
see, is the effect of alcohol versus not, does that affect your sleep?
Yeah, it does. Absolutely. And it sort of takes us to the pill issue that I brought up earlier, benzodiazepines or hypnotics or antihistamines, things of that sort. It has a similar effect. Right? You're going to conk out, but your sleep's not going to be as restful. It's not going to be as
a decreased deep sleep. They can be used, and I do use them sometimes for if someone's really desperate and just needs to get back on the wagon a little bit, but then trying to get them off of that, so it's not a long-term thing.
Yeah.
So they have their role, but like you said, it's one of the things that we would use for last resort. We wouldn't start with that ideally.
Yeah. So just on a bit of a tangent. I was recently in Colombia, just got back last week actually, and was visiting Bogota, which is at a higher elevation. And I was wearing my Oura ring, and my heart rate was sky high. Well, for me, it was like 70s all night because of the elevation, right? It wasn't because of anything else going on, but the Oura ring tagged it as something that was affecting my sleep. It actually was able to measure that and tell me that, hey, look, there's something going on here. You have to work on this or fix this. It was really interesting to wear that at a high elevation too. It learns your body and can give you feedback on,
that's interesting. Elevation is something that probably your body had to adjust to, and it was a bit stressful. And then after a while it adjusted. I think we should mention also some medical conditions that might interfere with sleep. Sleep apnea is a huge one. A lot of people. So another big thing, if you're listening to this and you have a sleeping problem, if lifestyle is not fixing or not correcting your sleeping issues, then you might have a medical issue. So go see your provider about that. But sleep apnea, so there's in-lab sleep tests now. Now there's home sleep apnea testing as well. But these are things that it's hard to diagnose, I think, without, there are some validated questionnaires you can use. There's one called Stop Bang, and there's like the Pittsburgh Sleep Scale, I think, and stuff like that. But you really want to get a sleep study to really kind of quantify oxygenation levels and, how much time you're spending in deep sleep, REM sleep, and whether or not there's any apnea episodes, which is basically when the airway is not fully open, so the brain and the body's not getting enough oxygen. And you wouldn't really know that without a test. And a lot of insurances are pretty good on that now, but I think in general, that's one of those big things to rule out if someone's having persistent sleep problems. Yes. The other thing is sometimes there's actually an association between, we should not miss this either, mood disorders and sleep. Insomnia or hypersomnia, which is having too much sleep, that might be a sign of depression. That might be a sign of anxiety, and a lot of people are anxious right now, but anxiousness versus anxiety disorder, feeling down and feeling blue versus like depressive disorder, there's slightly, there's a difference there. So I think, again, going to see your provider, practitioner about that. So there's a lot of sort of from a root cause, functional medicine, which I know we're both into here. Space, there's a lot of root causes of why someone might not be sleeping, but we start with lifestyle. And then after that, if that's not working, then we go for these other possible things that are going on.
Yeah. And if your partner mentions to you that you're snoring so loud, you're waking up the neighbors, or you're having periods of apnea at night, you may want to consider a sleep study, because those are some of the signs of sleep apnea.
Listen to your partner, happy life,
Yes.
Yeah.
Also, let's talk about supplements. Actually, before we talk about supplements, I want to talk about stress just for a bit, because you mentioned stress before, too much on your plate syndrome, as you called it. That happens to all of us. We lie down. These thoughts are just running in our minds. We're like, oh my God, I'm thinking about this. I have to do this, and this. That actually affects us from a physiologic perspective, and from a mental perspective, and it doesn't allow sleep. So what do you recommend in those situations?
Well, there's two aspects of stress or, too much on our plates. There's the actual amount on the plate, which is kind of like what's called the allostatic load or the amount of stress. And then there's a concept called resilience, which is how we deal with the stress. So we can have we can have a low amount of stress, but then a low amount of resilience. And then that small amount of stress, at least to some other observer, might actually be overwhelming to that person with low resilience. Or we can have a high amount of what's called, allostatic load, or a high amount of things on our plate. But if we have a high resilience, then that's going to make it easier for us to handle that stress, and our bodies will be able to accommodate that more. So I think both are important. So we need to look at how much stress we have in our lives in terms of how many things that are kind of to a point where is it causing dysfunction in our lives or causing imbalance in our lives, is reducing the stress load if we can, and sometimes we can't. Sometimes it's not within our control, but reducing the stress load as much as we can. And then number two is increasing the resilience, increasing the ability to respond to stress. So I would say, from the perspective of reducing the stress load, some people need to get a new job. Some people need to get out of a toxic relationship or something, right? So these are the type of things that are really deep, root cause, like what's going on with the stress. The other thing is, and some people like we were mentioning, just have a TMOYP situation, too much on their plate. So what can they delegate? What can they prioritize as primary versus things that they put as secondary, to say, we're going to put that on the back burner. I'm going to put that on the back burner. I'm going to get to it, but I'm not going to put pressure on myself to do everything at one time, because I just can't do that. So there has to be some give and take like that. On the second end, in terms of resilience, there's a lot of ways to increase resilience, but I think the biggest thing is to increase vagus nerve activity. So we have what's called two parts of the autonomic nervous system. This kind of controls the body's response to stress. We have what's called the stress response, which is basically governed by the sympathetic nervous system. And then we have the relaxation response, which is basically governed by something called the vagus nerve, which is a wandering nerve that wanders from the brain to the gut, to the heart, and everywhere in between. And this idea that if we increase the vagus nerve relaxation response, we'll cultivate more resilience. And then we'll also do good things like increase our heart rate variability, which helps our heart and brain function. As you know, from the Aura ring, Ravi, we can increase our HRV. That's going to help our health. But I think from the research, we know that there's actually certain practices that are really, really helpful for sleep. Number one is meditation or mindfulness, deep breathing and meditation. In fact, I have a quote from Dalai Lama, and he says, sleep is the best meditation. So I just remember one time, because I like these tangents. I was trying to meditate one time when I was on a long plane ride somewhere, like across to the West Coast. And, I was also like really tired and stuff. But this mom was like holding this baby right beside me, and the baby was screaming. Right. And I asked my meditation, teacher at the time, I said, if the baby is screaming and I just want to close my eyes, like, should I meditate, or should I, what should I do? He's like, no, just like let the baby cry. And, or if I'm tired and I want to go to sleep, should I meditate? He said, no, just go to sleep. Right. Because you can't really do, in my opinion, you can't really do a good meditation or mindfulness if your brain is exhausted, because you need your brain for that too. So, but on the flip side, more meditation and mindfulness and, doing a consistent practice, maybe 5-10 minutes a day, ideally, at least would help sleep. It would help to reduce that stress. Other things that have some research, yoga. So there's studies that show that yoga improves some sleep quality index, specifically Hatha yoga and yoga nidra have done that. Acupuncture. So they've done acupuncture versus no treatment. So acupuncture is actually superior to medications in many of these studies for increasing the amount of sleep duration. And all these things work by basically restoring nervous system balance. They can reduce anxiety. They can improve the vagus nerve, which is increasing that relaxation response. So there's a lot of these therapies that a lot of them you can do yourself too. I should say that, let's say someone doesn't like needles and they want to do this combo yoga acupressure. To me, the best thing is child's pose. If you've ever done in yoga, child's pose, which is basically where you press your forehead down, you kind of kneel like you're in a prayer position or something on a mat or floor, and you put this third eye point on the ground. That's child pose. So that's actually probably, maybe people realize this or not, is that's activating an acupuncture point called governor vessel 24.5, which is going to be very calming. And let's say you don't have a floor because the floor is dirty. You can just do it on your desk. You can just do it on a table. You can just put, like I can just do right now, I can put my forehead on this table and I'm going to get this calming response by that stimulation from the acupuncture point. So there's a lot of like really easy tricks you can do to kind of, and let's say someone's in bed, same thing. And I've had this, I've done this myself, is I can't fall asleep. I'll actually just do an acupressure point. I'll just, on this third eye point, I'm going to press down on it for a few minutes, and then I'm going to do some deep breathing and it helps you fall asleep. So these are just really easy things that people can do lifestyle wise to help.
Yes.
But it is about stress, and it is about trying to manage that and being resilient.
And thanks, Andy. And I'll just add to that. Journaling is something else that people may find useful. I find it useful.
Absolutely. Yeah.
Writing down, if there are things running in your mind, write them all down, get them on paper, and then think to yourself, hey, look, I don't have to tackle this tonight. I will get to it tomorrow, or I will figure out a time to get to it. And then make sure you do get to some of those issues. That is very helpful. And then also gratitude is extremely powerful. And if you write down, and I started doing this, 3 things you're grateful for every evening, and just kind of focus on those and things that you're thankful for, and do that before you sleep. That's also very powerful, and that will help you.
Yeah, I second that too. I mean, I'm a little more low tech than you. Sometimes I'll just use a Post-it note. That's my take at night. But I like the gratitude. I do gratitude journaling in the evening, in the morning. But I think in the evening is a good idea too, because it kind of wraps up the day a bit and gets your thoughts and emotions on paper. But I like the idea of writing something down. I recommend that, and I do that myself too. Is I'll write stuff down before bed, and I think it really helps.
Absolutely, excellent. Yeah. Well, we're running close to the hour here, but I do want to get to some supplements, because people can do all these things, and maybe they don't have medical conditions that they need to worry about. They still do all the sleep hygiene things that we recommended, but they're not sleeping. The supplements can help. So what supplements do you recommend, and at what doses?
Yeah, the ones that I've found to help the most in practice are magnesium, melatonin. There's also glycine, which is a calming amino acid. And sometimes ashwagandha can be helpful as well. Some of these adaptogenic herbs, lemon balm and valerian would also help. So there's actually studies on a lot of these. I also think for those who are into hemp and cannabidiol CBD oil, I also have found that to be helpful as well.
Okay. And then, so magnesium, there's different forms of magnesium. Magnesium glycinate, is that what you'd recommend?
Glycinate is what I'd recommend, because you got the glycine in there, which is calming, and then magnesium is itself calming. So I think both, that combination is really good, magnesium glycinate. If people don't like taking supplements, I'll also recommend an Epsom salt bath, which is made with magnesium sulfate. So that's really nice for people that want to do it more of a bath way. And
then melatonin, you take an hour before you sleep?
An hour before, about an hour before. I'd say 8 to 9 p.m. would be the ideal time if someone was able to go to bed by 10.
And do you take a sustained release or a immediate release?
I personally, when I take melatonin, I take a liquid liposomal melatonin that kind of is dissolved in some fat molecules, and that helps the absorption, I think. I don't know. I don't think that's sustained release, but there are some that are SR sustained release that are good. So it sort of depends. If someone's having trouble staying asleep and you think it could be from the melatonin, you could try the SR. So I think that definitely helps some people.
Passion flower, chamomile.
Chamomile, passion flower, lemon balm. Yeah, all those. Most of those work by increasing GABA, which is a relaxing neurotransmitter.
Okay. And what about just taking GABA supplements like theanine?
You can take that. Yeah, you can take GABA supplements. It is important to know for the listeners that acupuncture and meditation are going to increase GABA as well.
Okay. So better do it naturally, but if those natural ways don't work, you can consider.
Yeah, nutraceuticals. Yeah, I think that would be pretty reasonable. Yeah.
Okay. What about 5-HTP? Is that something?
Yeah, that can definitely work. That can definitely help. So that will eventually turn into serotonin and melatonin, and that can help.
Okay. Okay. So you guys have a list of some of the recommendations, and the doses, I guess, vary depending on many factors. But I guess for the common ones like melatonin, what kind of doses do you?
I would start out at 1 to 3 milligrams for that one. Probably for magnesium, something like 200 to 400 milligrams. These are very safe doses, very conservative doses. So, and then if you want to go up on it, I'd probably talk to a provider about that.
Okay, excellent. And the teas are obviously, tea bags.
Teas are teas. Yeah, that's pretty much. None of them have caffeine in them, so I think those are the herbal teas. I mean, so I think those are good. Like sleepy time tea. I think some of those are really nice for people.
Excellent. Well, Andy, thank you so much. This was amazing. I really appreciate your time. We unpacked a tremendous amount of information in this hour. And how can people reach out to you if they're interested in learning more about you and your practice?
Thank you, Ravi. Thanks for having me on. So we are at Capital Integrative Health. Pretty simple. It's a clinic in Bethesda and in Montgomery County here in DMV. So we are at cihealth.org. So cihealth.org is probably the best place to start.
Wonderful. Thanks so much.
Thanks, Ravi.
I hope you enjoyed this podcast. And if you did, please make sure to hit the subscribe and the like button and leave a comment about what you'd like to see on our future episodes. Just a reminder that this podcast is for educational purposes only. It does not substitute for professional care, nor does it constitute medical or other professional advice or services. If you're looking for medical care, please seek a qualified doctor or medical professional. For more information, or if you'd like to check out our programs, please visit our website, peakwellnesshealth.com. That's peakwellnesshealth.com.